Welcome back, knife nerds and everyday carry people. It's your boy, the Big Canucker, and we're going to be doing something a little bit different here today. And it has to do with a part of my life that I've kind of shared a little bit, and I just wanted to share this with you guys too as well. And I'm really, really hoping that it affects somebody's life out there in a positive way. Because it sure affected mine in a really extremely positive way. Now, first of all, I want to preface this by saying I am not a medical professional, I am not a doctor, and I am not giving you medical advice. I am just relaying to you guys something that has helped me, and that I want to hopefully impart some knowledge that it'll help somebody out there. Now, many of you guys know that I have suffered from some medical conditions here. I've had 3.5 operations in the last 6 years. I've been off work. I was isolated. I was I put on a lot of weight, 70, 80 pounds. I was extremely depressed. I also was extremely anxious too as well. I really suffered from anxiety in all forms. I was suffering from panic attacks. And it just I wasn't myself. Like, I'm a big rough and tumble guy. Before I shrunk, I was 6'3", and I was a really, kind of solid 235-ish. And since I've had these surgeries, I've ballooned up to, 290 pounds or so, and I had zero energy. I was really depressed. I mean, my wife wasn't too super happy with me, and my entire life was I'm not gonna say it was a mess, but it just wasn't going the way I wanted to, especially with the panic attacks. I'd never experienced those in my life. I mean, one time in a plane, but other than that, it was horrible. And I ended up seeing a doctor, a therapist, and who recommended me to an endocrinologist, and we ended up looking at something called testosterone replacement therapy. And I gotta say that this may not be right for you, but what it did to me is it completely turned my life totally around. I mean, I was feeling like I wasn't myself. I was feeling like I was scared of everything. And I'm not a scaredy cat guy. I mean, I have literally been in life or death situations. I have been clear-headed, saved lives, and I have saved lives a couple of times in my life, and I'm not bragging. I mean, there have been a couple of times where I did save lives. The second one was another time I had a fella point a gun at me, and it was really bad. But he was a real crazy guy, and a clear head saved my life. I never panicked, but at the drop of a hat, in the middle of this going on, I would panic at everything, and it was awful. So what I ended up getting was started with some therapy and stuff like that, and a big part of this I attribute to is testosterone replacement therapy. And let's kind of go over it, and it may not be right for you. And there is some positives and some negatives too as well. All right. Now, you may think that you need testosterone replacement therapy. If you have some of the symptoms here, a low sex drive, erectile dysfunction, fatigue and poor energy level, decreased muscle mass, body or facial hair loss, difficulty concentrating, depression, irritability, and a low sense of well-being. And a lot of those were on this guy right here. Now, I happen to take testosterone I get it in an injection, and I actually self-administer these injections, and that's what I kind of want to go through with you guys today, just to kind of maybe take care of some of the fear of this, and maybe some of the stigma too as well. And we're going to kind of do that here going forward. All right. So now this isn't all roses. But we'll go over that in a second. But you can actually I want to go with we have the injections. There's actually a skin patch that you can put on daily. There's little gels that come in tubes that you can just kind of rub on your arms or your hands or a spot. There's a mouth patch too that you kind of it glues itself up into your lip, and it just twice a day you put those in your mouth and they dissolve and they release testosterone slowly. And there's also injections or implants that's actually you'll get an implant put in and it lasts for a certain amount of time, whether it's 2-3 months or a year or however long it lasts. It just slowly dissolves in your body, keep your testosterone level straight. Now, for me, what it did for me, myself personally, it made me feel more like myself. It gave me a really I wasn't like, hey, I'm ready to kick some ass and fight and anything like that, but I felt like I could handle situations again. it increased the sex drive a lot. And I mean, my wife phones the doctor once a month and thanks him, and I do too. It did a really good job that way too as well. And it's also, I feel stronger. I have a lot more energy, and I feel way more vigorous too as well. Just overall good sense of vitality, and I'm really surprised at how well it affected me mentally. Now that's not to say that there is like it's all roses. Like there is some problems that could happen too as well. One is called benign prostatic hypertrophy, which is basically your prostate as you old it grows, and adding testosterone or excess testosterone into your body can increase that growth to where you've got a prematurely swollen prostate, where that will affect going to the washroom or even sex drive, or even lead to cancer too as well. So there's that. Prostate cancer, it can increase the risk of that. Sleep apnea, and it can be worsened. If you've got sleep apnea, it can be worsened by testosterone. Blood clots too as well. Especially if your family is really prone to a lot of blood clots, this could be an issue. And congestive heart failure too as well. The other thing too as well is it kind of thickens your blood. It increases your red blood cell count. And every Thursday, I end up going to give plasma at our local blood donor place. And that's another thing I gotta say. If you are out there and you have got a little bit of spare time, go give some blood, go give some plasma. Help, save somebody's life that way too well. And it's just so easy. You get some nice cookies and juice after you're done, and you get a really good sense of that you helped out your community. And anyways, they measure my hemoglobin every time I go there every week. And it typically is around 190, which is quite high. 120 is where you need to be to give blood, but mine is 190. And I think a lot of that is to do with the testosterone replacement therapy. So that's something that I think I'm going to need to watch here going forward. If it gets a little too high, I could, increase risk of heart failure and heart disease for me. Okay, so, all right. No, so it's not like a steroid, but it does. I mean, you can lift weights and you will get stronger. You will build muscle. I mean, a lot faster. Than actually not using it. So, all right, now there may be something that I have forgotten or something that I missed. I certainly hope so, because I certainly hope not, because I want to make sure that you guys are informed before you guys go ahead of that. So let's go to the tabletop and let me show you. Every Friday I give myself an injection, and I will kind of run through that with you. All right, let's head to the tabletop. All right, so here what we have is we have got my brand new bottle of, now what do they call this here? They call this Testosterone. Basically, it's a testosterone ethanethate injection. Now, this is a new little bottle here. So now I'll open that up. So we will practice some good medical practices here. And so I've got, of course, a sharps container. And I end up, now this stuff here, now, I wasn't born knowing how to inject myself with things. My local pharmacy, you can take a little course, just a little in the pharmacy course, and they will teach you how to give injections to yourself, which is a really, I don't know, I would say it's a handy skill, but it's just something that I learned, and I was very kind of happy that I did learn it. Now, the other thing too as well is they teach you, good hygiene. They teach you, good techniques and stuff like that. Now, I normally don't wear gloves every time I give an injection. I'm just going to follow the letter of the law just to decrease the risk of infections. If you have a lot of these medical gloves, wear them every single time. I just have not happened to. All right, so we've got our sharps container. We're going to put that off to the side for now. And the pharmacy also supplied me with the syringes too as well. And that's just part of, here in Canada, I mean, we've got a really good healthcare system, and I'm certainly not knocking anybody's healthcare system out there, but you're, whether you have to pay for this stuff for yourself or there's, your insurance will cover it, it's always, handy to have your syringe. And also 2 different gauges of needles too as well. And that'll explain here a little bit later. So here's your antiseptic pad. And what you're going to want to do with this is put this aside. And because this is a brand spanking new bottle, you'll have to pop the cap. And this little lid here will not go back on. It's a real pain in the ass. And then you want to basically wipe the top. Make sure that there is no way that you've got contaminants on top there. And then you want to open up your syringe. Hopefully I'll keep this all in frame. Oh, I'm sure there's a million jokes about this that can be made, but dude, it happens to everybody. We all get older. We all, suffer from issues and things like that. And I just happen to suffer from a low testosterone. And just to give you an idea, when my doctor measured it, now, if I remember this correctly, just to give you an idea, the average... Now, they're going to use a number of 20. That's kind of your average of where everybody, you normally like to see it is, I don't know if that's 20 parts per million, 20 milligrams per 1,000, or whatever it was. I just remember that there was the number 20 where they said that was average. And mine happened to be 3. And I thought, and he thought, well, that's definitely something that we need to look at here, mister. So we ended up, starting the first injection, and we started, so now this here injection, here is it's 200 milligrams in here, and mine is 1 milligram per week, and you can vary that too as well, or you can get it 1.5, 1.25. So because this stuff here is a little bit more concentrated, it's actually 0.5 milligrams is what this one is. My old bottle was a little bit bigger, and I would do 1. They give me some new stuff here, and now it's half a milligram. And so anyways, so I was at 3. So now I've got 2 gauges of needles here, and I don't remember which way these needle gauge works here. So this one here is 23 gauge, and the one here is, this one here is 20 gauge. So I guess the smaller the number, the larger the diameter, and you're going to want a larger diameter needle to withdraw, because this stuff here is really, really soupy, or not soupy, it's really, really thick. And so if you don't have a larger gauge needle, it will take forever to draw out. Now you want to use this one, the smaller the gauge needle, you want to use these ones to inject because it's way less painful. Now you can inject with this 20 gauge, but it will hurt way more. So now the other thing they taught me was to, pull it back a little bit to around 1 mil, because I'm going to be bringing it in half, and then you kind of inject the air inside the bottle. And so that will help force out the testosterone. As you can see, it's starting to fill up. And just gently draw it out. You don't want to get too kind of rammy here, trying to draw it out. Otherwise, you get lots of kind of air in there, and it also becomes almost saturated, like where you pull on the syringe, and then you can see that all these little air bubbles in there, but as soon as you let go of the syringe, it's almost like they disappear. It's really kind of weird, and I just don't want to be injecting those into my body. So you can see now that I am past. Now, that's what they told me to do here. So I'm not sure if you can see, but I am at just past 1.5 or 1/2 milligrams, and they told me just to go a little bit past, and you can see there's some air in there, and we want to kind of get rid of that. And so we'll just tip it up, give it a little bit till you can see the air kind of going back in there. And now you can see that I am right at 0.5 milligram, just an extra little bit there, and I'll draw that out. So now, a couple of things here. They say never kind of put the cap back on your needle, because you'll end up, there's a greater risk of giving yourself a little poke. But I mean, well, I'm giving myself the injection, so if I give myself a little poke in the finger, it's not like I am going to give myself, Hep B, because I don't have Hep B, but then I just drop that into the sharps container, because you always want to practice, disposing of these properly. And then I end up, once this is full, I end up giving this to the pharmacist. He gets the, what did I do with it, man? He gets the stuff at the end. Oh, there it is. He gets the full sharps container. So now what we want to do now is open up this new syringe or new needle. So this 23 gauge needle instead of the 20. Now we use the 20 to withdraw it. And now we want to make sure that there's no little air in there. And then we want to just fill up our needle just a smidge until you can see it just start to come out. Then you know that there's no air left in there. And there you can see it just starting to come out. So now we're going to get on to the injection site. All right, I apologize for the technical difficulties that we had. I injected myself, and I did not press record on my camera to inject it. So rather than wait a week to give myself another injection or give myself another injection, I just decided I thought I would do is I would recreate this injection. So you'll see me talking on the video here about me, getting some stock footage. That was my original plan, but I just thought, what the heck, you know what? I could just do a recreation. And this is basically what it does is, what you want to do here is, this is an intramuscular injection, which basically means you're going to inject it right into the muscle. There's no vein that you have to worry about. And you can inject it into, you've got two big large muscles in your thigh muscles, one on each side of your bone of your femur here. So you got one on the side here, and then you've got one on this side. There's also this kind of little cap muscle there that once in a while will inject. But you definitely want to kind of pick one on the other side, below the groin too as well. And you could also inject it into the buttocks if you could reach, or have somebody do it for you. I've seen people do it into the abdomen, but I've got way too big a spare tire for that. And so basically what I would do is I would use my kind of 23 gauge needle. I have my injection site, and I just basically give it a clean off with a sterile pad. Now, normally I would do this way ahead of time if I had a needle, because if you've got the alcohol on here and you do your injection, it just gives it a little bit of an extra sting. So then basically what I do is I will find this. I don't need to pinch or nothing like that. I just basically take it, try to keep it parallel with the skin. So you want to make sure, if you got an angle, you want to make sure that you're keeping your syringe parallel with your skin, or perpendicular with your skin, rather than parallel. So you can just basically go into the muscle. Now, once you've got your injection needle in, and basically what you want to do is you want to just slowly depress. And because it's a thick liquid, it's going to take a little bit of two, right? So it doesn't just go squirt right in. It does just, sometimes it burns a little bit, and you just kind of slowly depress it. Now, once I have this completely depressed, I always like to give it a little bit of a 10 count, just because when you withdraw your needle, if you just inject it and pull it out right away, some of the testosterone won't exactly go inside the muscle. It'll squirt out, and then you've basically wasted some. So I give it a kind of a 10 count. And then once I withdraw it, I kind of just take it, withdraw it, and then most times you'll see just a tiny, tiny little bit of blood, just maybe a red mark. Then I just simply press a sterile pad on it till the bleeding goes away, which is usually, if I've done a good job, it goes away almost immediately. Then I'll wipe it off. Sometimes, I'll put a little Band-Aid on there, especially if I hit something and it's bleeding a little bit, I'll put a Band-Aid on there. But for the most part, I just make sure that it's kind of wiped away, and then I'm done. And Bob's your uncle. And then you want to make sure that you take your needle and your syringe and put it away in your sharps container with your sharps, all your other sharps, and just dispose of it correctly. All right. And the other thing is, do not use syringes over again or needles over again. You're setting yourself up for an incredibly painful ride down the road, which you could develop an intramuscular cyst or an infection, and it can be an awful, awful thing. So do not reuse your syringes, no matter how tempted you may be. Go the extra mile and get yourself fresh stuff all the time. All right, let's head back up to the top to say goodbye. Looks like. All right, so please, you guys out there, I hope that you stay safe. I hope that this kind of helps somebody. I hope this really makes somebody's life a little bit better. Now, also, please do your own research. Talk to your doctor. I'm not a medical professional. I'm just somebody who's benefited from testosterone replacement therapy, and I just thought that I would share that with you, the benefits that I receive and the benefits that I think other people could receive too as well. It's a real viable medical thing out there, and you may not realize that if you're at home suffering from depression or low well-being or anxiety, it may not be something so in your psyche. It could be something as simple as a low testosterone. So please, if you're out there seeing a therapist, bring that up to them, bring it up to your doctor, get tested, and that could be, an answer like it was for me. Now, it didn't cure every single one of my ailments. I mean, I still suffer a little bit from some anxiety, but I feel 110% better, and I certainly hope that it continues on like that. So please stay safe out there. Keep your stick on the ice. This is the Big Canucker saying adios.